I'm the athletic trainer at Rancocas Valley Regional High School. I've been there for 28 years. So I've dealt with Leo, I've dealt with Brian Boker. Now I got the other Boker. I was at Delran for 6 years, dealt with Dennis Smith. I think we have a love-hate relationship, athletic trainers and wrestling, but it's a great sport, and I like it. And hopefully we can get this skin thing under control or keep it under control. That way it's not going to cause any issues. I'm not going to say I'm the expert. I've been doing it a long time, so I feel confident with it, but we're always learning every day. I'm going to go through this quick. This presentation, Mark's going to have it. I will have it. You're welcome to get a copy of it. I've got a whole bunch of slides, if we have time, that I'm going to go over. They're not marked what skin lesions are, but basically for the last 20 years I've been taking pictures. I've got it on my Mac, and I've taken them out, and I think it's a good library for you guys to look at, especially the newer people, because now that you might be getting involved with actually having to do the skin checks. I'm going to go through this as quick as I can. That way I'll have plenty of time for questions. All right, first of all, skin infections. All right, there's always some amount of bacteria, fungus, virus living on us. That's normal. It's there. So that's why we need to make sure that if there's any open wounds, they're covered up so these things don't get worse. All right, skin infections occur when there's a break in the skin. All right, as far as problem skin lesions, you always need to worry about lesions that have irregular borders. All right, lesions that are raised and wet and moist, as Sean said earlier. All right, I mean, these are the obvious things. When we're doing skin checks, I'll be honest with you. All right, I've been doing it for a long time. I'm not looking for the minute things. I'm looking for the thing that, oh my God, that's not good, or the obvious things, the ringworm. All right, and it's going to stand out to you pretty much when you see it. You don't have to necessarily be an expert. Worry about lesions that have different colors. All right, within the lesion. All right, bright red colors. That's a telltale sign. Anything that's warm or it looks warm, you're going to ask the athlete, hey, does that thing feel warm to you? Those aren't good signs. An athlete with a prior history of skin infections, which is something you guys might not know, but it's something you could ask. All right? Abrasions increase the risk. The deeper or larger the break of the skin, the more likelihood something can get infected. All right, some skin infections got bacteria and fungal and viral. Those are the three things you're going to be dealing with. All right, bacteria, there's different ones. Most common ones, impetigo. Now the problems we got to really be careful about is staph and MRSA. All right, there's some nasty staph infections out there, and these things are hard to control, and it'll put kids out for a week to 2 weeks, if not longer. Put them in the hospital if they're not treated quick enough, because they'll actually need IV antibiotics. Fungal infections, ringworm. You know, I thought I'd never say this, but as an athletic trainer, you know what? Kids ought to be able to wrestle with ringworm. It's not something that's going to bother you. It's not something, it's going to go away. It's treatable. So it's something I think eventually the medical community should say, hey, yeah, we don't want kids with severe ringworm wrestling, but it's really not that much to worry about. But we still got to worry about it. All right, it still needs to be treated. All right, and then viral infections, which is the herpes. That's the big thing. That's what everybody's most worried about because that's where the lawsuits are coming from, unfortunately. And that's a viral infection. First of all, impetigo, it's a bacterial infection. All right, usually it's going to be blistered, it's going to be red. All right, and telltale sign of impetigo, real simple, honey colored. If you see something that's got any kind of color that looks like a honey color and it's red or even it's abrasive, that's probably going to be impetigo. Unfortunately, by the time you guys see it, it's probably not going to look that way. All right, because these kids are smart, the coaches are smart. They're going to scrape it off, they're going to bleach it, they're going to do anything they can to make that go away. All right, but so most of the time when we see it, it's, I mean, easy to see. All right, impetigo. It may blister or break open, again, honey colored. That's, I mean, that's pretty obvious. I doubt you're going to see something like that, but you never know. I got other pictures that aren't as obvious. As far as acne, And that's why kids, it's hard to tell. You may not. That's why I tell all my kids, anybody that's got, I mean, there are some kids that have, I mean, you don't see it as prevalent as it used to be because of the medications they have now. I mean, the kids, and you can almost tell, when I see a kid from another school, I could tell a kid that's on Accutane or on something because their skin is dry. They're red, all right, because they're on this medication. All right, but the ones that aren't on meds and they have severe acne, it's touch and go sometimes. I usually get a history, find out, hey, do you have acne? And if the kid says they have acne, and then I'm looking them over pretty good, and I don't see anything that's moist, all right, that's open, all right, obviously open. It's just pretty much doesn't look like, then I'm usually okay with it. But sometimes I've had kids with impetigo clustered in with it, so it's hard to tell. Bottom line is, if you're not comfortable, they should have a note. It's that simple. They should have a note. And I'm going to go back to that, and I'm going to keep going back to that, and I'm going to keep going back to that. And that's what I tell all the athletic trainers. You know, the bottom line is they got to have a note. It's that simple. And that's always the telltale thing to go back to. They should have a note. Another picture of it. All right. This one's a little fuzzy, but it's a good picture of it. Again, telltale sign there, it's honey colored. See that honeycomb color? That's classic impetigo. Now, this one's not so easy. I got actually a stage of pictures of this. This kid's got it. That just looks like he's got an abrasion. But you're not going to see, and this is another sign of a skin infection. With impetigo, it's usually not in one spot. And you're going to see different spots because what happens is if they've got it long enough and they're not treated correctly or not treated right away, it's going to spread. So you're going to have some lesions that are scabbed over, some lesions that are scarred over, some lesions that are just ready to open up, some lesions that have just opened up. If you see clustered stuff, if it's not acne, then it's a skin infection. It's that simple. And again, getting the history from the kid. Do you have history of acne? Now, don't get me wrong. All right, there's some of them that are smart enough, they're going to lie to you. All right, so again, if they don't have a note, then sorry. Next, staph infection is another skin infection caused by bacterial, but this stuff's nasty. All right, and it is scary, and it's getting worse every year because basically the bacteria are mutating, they're adapting to the antibiotics, and they're getting stronger, and some of the antibiotics aren't working on them. That's basically what MRSA is. Again, you're probably not going to see something like this. You're going to see something closer to what I'll show you in the other slides. I don't think I have it on these. That's a staph infection on the hands. All right, MRSA. MRSA basically is methicillin-resistant Staphylococcus aureus. Basically, it means it's resistant to the normal antibiotics that they're using. If these kids don't get treated right away, this thing's going to get worse. And the problem with MRSA is, and with us, and even the kids, most docs will not culture it, which they should be culturing everything, and they start treating it with an antibiotic. Then when that doesn't work, now they can't culture it, because once you treat something with an antibiotic, culture is not going to work. So they got to guess and say, okay, now we think it's MRSA because it hasn't responded within 3 or 4 days to a week, so now we got to give you something for MRSA, where they should have been culturing it right away. That way they know, so we can get these kids better quicker. What's scary about MRSA is it doesn't start, and even the staph infections, they don't start, you think it's going to be something really ugly. A lot of times, it just looks like a pimple, but a big, nasty pimple, as you can see with this picture right here, on the one on the arm and one on the thing. But it's different than a regular pimple. If you ever seen a spider bite, it almost looks like that. All right, when you get bit by a spider, or sometimes with an insect like that, you get it's not like a bee sting. It's rounder and it's just nastier looking. That's just what they look like. And what's scary is, they can go from one day to looking like that, the next day to, just blossoming and not being good at all. All right, as MRSA infections occur, touching one person to the other, touching surfaces, sharing personal hygiene stuff. So it's why these kids, they gotta have good hygiene. We gotta clean the mats, do everything the right way. Those are some pictures of it. Again, you're not going to see that, all right? Because something that bad probably isn't going to get to you, my guess. But ringworm is antifungal. All right. And again, like I said, it's technically called tinea. It can be treated with antifungals, and you can treat them with right over-the-counter stuff. Obviously, this wouldn't be a situation where you could treat it over-the-counter. This needs to be probably an oil and a prescription. This was actually, believe it or not, a young lady who came into my training room one day and said, "Hey, Mr. Haynes, what do you think this is?" She wasn't a wrestler. She was equestrian. She was rode horses, and that's a place where you get it. Animals tend to have it. If you're dealing with dirt, you're dealing with manure, that type of thing. So right away when she told me what it was, I said, "Oh, know where you got it." Treatment of ringworm, again, antifungals. Ringworm's pretty easy to recognize. Even though it's not round, all right, it's always some type of circular, and it's usually red and raised. Whoop, sorry. I have other pictures of the other one. I skipped ahead of myself there. All right, next, herpes. All right, this is the reason why we're here, mainly. All right, herpes it's a viral infection. It's the same herpes as a sexually transmitted. It's not on your sex organs. It's other places. All right, and if you have it, once you get it, you got it for life. Basically, what it does is it goes dormant in your nervous system, and it's there forever, and it never goes away. It will usually present itself once you've had it. Again, when you are under a stressful situation, particularly if it's physical stress, mental stress, social stress, nutritional stress, all the above wrestlers go through every single wrestling season. So basically, if you've had a hepatic lesion at one point in time and you're a wrestler, it's probably going to come out. We try to get the docs to do some preventative antiviral stuff that will, and the medicines have become a lot better to keep it from coming out. But if it does, the kid's got to be on the sideline and out until he's clear. Potential signs of herpes lesion. It presents itself, and you're not going to know this. It's the person who has it. But basically, that spot will itch. It'll get pain. You could have a large lymph nodes, fever. Bottom line, it affects your nerve endings. So it'll burn in that area, and it can hurt like hell. That's why with the sexually transmitted one, you don't want to have that on the privates, because when it comes, not a good thing. How's it usually present itself? Telltale sign, it is small blisters, and it's clustered. That's a telltale sign of herpes. That is classic herpes right there. You're not going to see probably one hepatic lesion. Usually there's at least 2 or 3, and they're going to be together. And it almost looks like a blister. When I first started looking at it, it looks like somebody got a blister, almost like having poison ivy. But it's totally different than as far as presenting itself with poison ivy. But again, you might not be seeing this. What you're going to see is if a kid's got it, he's probably going to scrape it off. He's probably going to dry it up or whatever. You might not see those blisters, but you're going to see those lesions, and they're going to be close together, and they're clustered, and that's a telltale sign. That's a problem, all right? And they should have a note. Classic. That's in the middle of a kid's back. That was one of our kids' wrestler. And you probably think, how the hell did he get it on the middle of his back? Well, when you're wrestling, guy on top, where does he put his chin a lot of times? Right on the back, especially if they're practicing or leaning on them. That's skin-to-skin contact. It can be transmitted carrier. Approximately 20% of people infected with herpes have experienced lesions, skin lesions. Obviously, you're not going to see that one, but that's a ugly one. All right, I got a picture of the skin form because I think it's real important because this can really be your friend. They did a real good job, I think, with the form finally. So make sure you go over that thing very well. All right, starting from the top, obviously, you got to have the kid's name on it. The cultured, most time, it's not going to be cultured. All right, the location of the lesion and number of lesions, very important. All right, and the reason why to me it's important, because bottom line in this note is pretty much God, and that's what you have to go by. But that note's not correctly done right, then as far as I'm concerned, it's out the window. All right? So if you have a note and there's a problem and you're not comfortable, then I'd go over that note. And I've had this situation happen, all right, for me and against me, all right, where we went back to the note and said, wait a minute, the treatment started here, it's supposed to be this many days, and it hasn't been that many days, you're not wrestling. All right, so let the note be your friend. Sometimes it's not your friend because some of these docs fill them out and you really question their education. Number of lesions, and it should be marked on there. So for example, a kid comes to you and he's got 1 or 2, 3 lesions anywhere on the body, and it's marked on that sheet as one lesion in that same location, and there's other lesions, and those other lesions look new, then guess what? That note's not current because that kid's got fresh lesions. So it's not good for that kid. Medications used to treat the lesion. Now, again, you're probably not going to be able to figure out the medications. Somebody else may. Usually they're going to say antiviral, antibacterial, or bacteria, or whatever. All right? But the key is how long they've been treating it. All right? The date of treatment. And a lot of docs do not do this. And a lot of the kids, parents, coaches don't get these forms filled out correctly. And I always tell them, I say, look, if they call you on it, you're not going to be able to wrestle because they can't determine when the time the treatment started. As we go to the next page, you'll see how that's going to work. All right, form expiration date, earliest date you may return for participation, that's an important one. All right, because I've had a number of kids bring notes to me and say, hey, Mr. Haynes, I'm okay to go back. I get the note, and the note says, well, yeah, you say you're okay, but the note says you got to wait 2 or 3 more days. So check the date on that note. All right, is that the date that he's determined to wrestle, that match? Is it okay according to that note? And again, this is all CYA for you too. Signature, the provider's name, it should be signed, the office address, all that should be on there. That way if you need to verify it. Because kids, parents, they're forging stuff. Next. This is what I really like about this form. It tells you if it's a bacterial infection, and on that first page should tell you what it is. Then it gives you treatment. And I know some people are saying, that's not my job. Well, I know, but the form can help you. All right. For example, as far as bacterial diseases, which would be infantigo primarily, they've got to be on an antibiotic for at least 48 hours, 2 days. Now, if the kid started treatment yesterday, and they said, and it says, and he wants to wrestle today, it's not been 48 hours. So there's your out, all right? He's not allowed to wrestle because it hasn't been 48 hours. So that's just one thing that can help you from that standpoint, all right? And that goes on to continue with MRSA and so on and so forth. With tinea, all right? They've got to be treated for 72 hours. 72 hours. And again, other things have to occur too, but these are just things you can look at for a note if you feel like, I'm not feeling comfortable with what I'm seeing, but yet the note says they're okay. All right, scabies, head lice, they put that in there. I've never had that situation happen yet, but I guess it can happen. Conjunctivitis and pink eye, haven't really had any dealings with that, but it could be. And musculosum, which is basically a fungus. But again, I wanted to go over that form for you because a lot of people just blow that form off, but it can be your friend sometimes because a lot of times it's not filled out correctly. I'm just going to go, all these are pictures. All right, so what do you think this one is? All right, herpes, why? Clustered and blisters. All right, yep. What do you think that one is? What type of infection would you say? Is bacterial, fungal, or? You think it's bacteria? Okay, it is bacterial. All right, it's a staph infection or it's MRSA. All right. Most of the pictures that I have on here that are staph or MRSA, they never really technically diagnosed it. All right, because again, they didn't treat it right away, so they had to do the treatment later as far as a MRSA goes. But this was a staph or a MRSA. Same thing. That's a staph or a MRSA. That was one of the pictures before, I believe. Again, see how it just almost looks like a big pimple? And if you hadn't seen that, you would think, that don't look that big of a deal. But it's not a good thing. What do you think that is? Ringworm, a big ringworm. Just a closer view of that one. That's it trying to heal, getting better. That's the same young lady. This was a young man we had. Now, there's going to be stages of this. You're going to see this is one day. All right. You see the honeycomb colored here, honey color up at the top and in the middle, but the other ones are kind of red. They're fresher. They haven't popped yet, so to speak, or they haven't blossomed. Now, the one in the middle that was honey color before, that just looks like a scab, right? But again, there's a bunch of them together. That's not normal, all right? All right, and if it's right there and not any other place in his body, it's not acne, because that's what they're going to tell you. Oh, I got acne. Sorry, you'd have acne other places in your body too. And it wouldn't be honey-colored in one or two spots. He's starting to heal now. You can see it's scabbing over. So he's getting there. He's got a long way to go with that many lesions. What do we got there? Ringworm. Again, it's rounded and it's raised. Now this one's pretty fresh because this one, it's red all the way. There's no circle in there, so this baby's fresh. And also, can you see, he tried to cover this up. Can you see where the Band-Aid was? It's amazing how many kids in weigh-ins come in and they got a Band-Aid on, and I'm going, okay. It's like you put an arrow saying, look right here. You know, and it's like, oh, I got to take that off? Yeah, you got to take it off. And it's, oh, wow, what's that? I got cut or something the other day. Yeah. Or got burnt. Yep. This is the herpes that was healing you saw on the kid's back. That's scarred over, and he's actually okay to wrestle, okay? And that's actually scarred over, and he's okay to wrestle. With a note, and he was treated within time frames he was supposed to be treated. What you see around it was, we've got Leukotape, which is special tape that doesn't come off. I still cover the lesions up. I don't want to take no chances. The more layers, the better. Now, here's one that you're all going to shake your head at and go, oh, come on, man. You're supposed to help us out. Now you confused the heck out of me. All right, this was a non-contagious thing. We never got a diagnosis on it. And kid was able to wrestle. It went away. We had no problems with it. All right? And you're saying, yeah, but so what am I going to do as an official? Same thing. It's a suspicious skin lesion. If he has a note, he's okay to wrestle. All right? And it really doesn't, even though it looks like it could be a herpetic lesion, it's too spread out for a herpetic lesion. All right? It doesn't have characteristics of ringworm, doesn't have characteristics of impetigo, and I'm not going to tell you that it's going to always be easy. All right? And if one of my kids came back and got disqualified with this because it didn't have a note, I'd have no problem with it because it confused the hell out of me when we had it with this kid. All right? That's why I told him, you need to get a note. You need to get a note. Now that is herpes. Again, clustered, that's just a different picture of the other one the kid had. What do we think that is? MRSA or staph? Yep. MRSA or staph. Now, that's a confusing one. That's a confusing one. It's Got a little bit of everything there, don't it? It looks like it could be ringworm. That's why I like this picture. It looks like it could be impetigo, but who cares? It doesn't matter. It's a suspicious skin lesion, and it's not looking healthy. All right, and that's one of the worst places because kids are constantly grabbing wrists. You can't cover that up. I don't know how many coaches the kids say, "Oh, Mr. Haynes, can you just cover it up?" No, I can't guarantee it's going to stay. That was a staph that was healing. Now, would that be able to wrestle without a note or even with a note? Nope, because it's still an open wound. It's not scabbed over. The edges are scabbed over, but the whole thing isn't scabbed over. Yep, that's a nasty ringworm. Mark, you remember this one?
Yes, I do.
I'll let you tell.
No, I don't
He could tell that story, not today though. He had a note, and I did not want this kid to wrestle. Yes, it did, and it got on him, and I had to keep from laughing because
the match was over.
yeah, he had a note. No way that kid should have been on the mat, but you know, should he have been on there? No, but yep. And this is him going through the progression of healing and looking better. You can see it's getting better. That was a staph infection. It was definitely a staph infection. It could have been MRSA. Again, docs didn't treat it the right way. Believe it or not, when the doctor first started treating this, they treated it like it was ringworm. And I just shook my head. What's that one? Ringworm. Easy. Easy one. Real easy one. It's faded, so it's starting to go away. It's either MRSA or staph. Now that is nasty staph on the fingers. And that is not a good place because your hands, a lot of nerve endings, that was not comfortable for the individual. I needed a closer up picture because from a distance, that could be 2 or 3 different things, to be truthful with you. I believe that was tinea ringworm. But that's something that could look like, if you didn't get a real good close-up look at it, it almost looks from a distance it's clustered, almost like blistered. But that was ringworm. You like that one? Oh, where do you see the next one? That next one's even better. I think it's the next one. No, easy one. Impetigo, honey-colored. Now, what do you think that is? It's a staph or a MRSA, all right? You might think, it looks like a big blister. Isn't that herpes? It's not clusters, there's one big one there. It's his knee. It's a knee. Here's a really good one. Actually, this is 2 houses over from my house. This kid lived here, was my neighbor. This was a case of not telling anybody, and this just got out of control. This kind of scared me. I thought this kid was going to be in the hospital with IV antibiotics, but he responded pretty good at orals. He was Asian descent, and the parents didn't really believe in a whole lot of going to the doctors. And this thing just went from not good to not good. Believe it or not, that was starting to look better then. That is better because now it's starting to, it's a different color red, it's scabbing over, so actually it's healing. That's when I knew that, hey, we're going to be okay. It was a staph infection, yeah. And even though it looks nasty, that's healing. Again, you're not going to, hopefully you're not going to see this, but crazier things happen. That's him on the other side. This wasn't just on the one shoulder and the front of the shoulder. What do we think that is? Ringworm. Yep. Same thing, ringworm. That's a healed herpetic lesion or healing herpetic lesion. Right on the forehead. Ringworm. Ringworm. See, you guys are experts already. That's a healed up staph infection or healing staph infection. That was a staff. And that's it. All right.